Welcome back to Contain Your Life. What if I told you that in the moments right before a major medical emergency, your body almost always sends out a warning signal? Most people miss these signals, but knowing what to look for could genuinely save your life or the life of someone you love. Today, we're covering 6 critical warning signs that demand your immediate attention. Stick around because this information is that important. First up, let's talk about a racing heart that comes out of nowhere. You're just sitting on the couch watching TV or reading a book, and suddenly your heart starts pounding like you've just run a marathon. It's easy to dismiss this as just a bit of anxiety, but if you're at rest and there's no obvious reason for your heart to be racing, it's a major red flag. This condition, called tachycardia, can sometimes indicate an underlying heart problem like an arrhythmia. Your first step should be to sit down and try some slow, deep breathing exercises to see if it calms down. If that fluttering, racing feeling persists for more than a few minutes, or if it's accompanied by dizziness or shortness of breath, it's time to contact your doctor or a medical professional right away. Don't wait it out. Second on our list is experiencing blurry vision that only lasts for a few seconds. You might be tempted to just brush it off as your eyes being tired or simply a sign of getting older. But these brief moments of blurred vision, sometimes described as a curtain coming down over your eyes, can be a transient ischemic attack, or TIA. Think of it as a mini stroke. It's a crucial warning that the blood flow to your brain might be temporarily blocked, while the symptoms may resolve quickly. A TIA is a powerful predictor of a full-blown stroke, which can cause permanent damage. Ignoring this is like ignoring a smoke alarm. If this happens to you even once, you need to see a doctor immediately to investigate the cause and prevent a more serious event. The third sign is perhaps the most well-known, but it's often misinterpreted: chest pain that moves. Specifically, pain that starts in your chest and radiates into your jaw or down your left arm. Many people convince themselves it's just severe heartburn, indigestion, or even stress. But this classic pattern is a hallmark sign of a heart attack. The pain might not even be that intense. It could feel more like a pressure, a squeezing, or an uncomfortable fullness. The key is its location and movement. With a potential heart attack, every single second counts. Do not try to wait it out or drive yourself to the hospital. Call emergency services immediately. Paramedics can start life-saving treatment the moment they arrive. Your quick action can be the difference between a full recovery and a devastating outcome. Now, for a stranger one. Smelling something burning when there's nothing actually on fire. This might sound bizarre, but it can be a serious neurological warning sign. This type of phantom smell, known as phantosmia, can sometimes be a symptom of a temporal lobe seizure. It's an olfactory hallucination, meaning your brain is creating a scent that isn't there. It's a sign that something is amiss with the electrical activity in your brain. While it could be caused by less severe issues like sinus problems, you can't take that chance. If you suddenly and repeatedly smell something like burnt toast, rubber, or chemicals for no reason, it's vital to consult a neurologist or your primary care doctor to rule out any serious underlying conditions. Your brain is trying to tell you something, and you need to listen. Number 5. Let's discuss the sudden onset of the worst headache of your life. I'm not talking about a typical tension headache or even a severe migraine that you might be familiar with. This is different. It's often described as a thunderclap headache, a brutally intense pain that peaks within seconds or a minute. It feels like you've been struck by lightning inside your head. People are often tempted to just go lie down and try to sleep it off, but that is the worst thing you can do. This type of headache can be a sign of a subarachnoid hemorrhage, which is bleeding in the space around your brain, often caused by a ruptured aneurysm. This is an absolute medical emergency. If you or anyone you know experiences this, you must seek urgent medical care immediately. Don't delay. Finally, number 6. Choking when you're alone. It's a terrifying scenario that can happen to anyone. If you find yourself in this situation, you won't be able to speak or breathe, and you only have a short amount of time to act. Panicking is a natural response, but you need to know how to save yourself. The most effective technique is the self-Heimlich maneuver using a sturdy piece of furniture like the back of a chair or a countertop. Position yourself so the object is just above your navel, then lean over it and thrust your body inward and upward, hard, helping to dislodge the object from your airway. Practice thinking through the motion now so your body knows what to do if it ever happens. These 6 signs are your body's emergency alert system, recognizing a racing heart, blurry vision, radiating chest pain, phantom smells, a thunderclap headache, or knowing how to react when choking can truly be life-altering. Knowledge is power, and in these cases, it's the power to save a life. Please share this video with your family and friends. You never know whose life it might save. Thanks for watching, and stay safe.